Imagine this. You step into the pasture, sunshine on your face, ready to greet your horse. But something's immediately wrong.
Yeah.
Their skin, especially on those beautiful white blazes or socks, looks raw, painful, blistering, like the worst sunburn you could possibly imagine.
Right.
Your first thought, naturally, might be severe sunburn,
Yeah.
right? But as we're about to unpack today, what you're seeing on the surface is often a signal about something far more complex and potentially much more serious happening on the inside.
It's a truly puzzling condition, and like you said, the visible signs really only tell part of the story.
Welcome to the Deep Dive. Today, we're taking a deep dive into equine photosensitization, a condition that makes a horse's skin abnormally reactive to sunlight.
Mm-hmm.
You shared some really detailed sources with us, and our mission is to distill those key nuggets of knowledge. We're going to explore what causes this puzzling condition, how to recognize its often painful signs, and what veterinarians do to treat and prevent it.
Yeah, and it's not just about understanding a skin issue. It's about grasping the fascinating and sometimes, frankly, alarming internal mechanisms at play.
Absolutely. So let's start right at the beginning. What exactly is equine photosensitization, in simple terms?
Okay. At its core, equine photosensitization is an uncommon but potentially quite severe skin condition where unpigmented, that means white or lightly pigmented skin, reacts abnormally, excessively, to normal UV light exposure.
And this is where it gets really interesting, because you mentioned it's fundamentally different from a simple sunburn. Could you really break down that distinction for us? Because I think for many people, sun-damaged skin just sounds like sunburn.
You're right to ask. It's a key point. Forget simple sunburn. A regular sunburn is direct UV light damaging skin cells. Straightforward damage.
Okay.
Photosensitization, however, is different. It's more like the sun triggering a chemical reaction inside the horse's skin. It involves what we call photodynamic agents in the skin.
Photodynamic agents, okay.
Yeah, imagine tiny invisible agents just sitting there, dormant. But once they're hit by UV light, they activate. They become energized.
Energized how? What do they do then?
Well, once activated, they produce these things called reactive oxygen intermediates.
Reactive oxygen intermediates.
Yeah.
That sounds potent.
It is. Think of them like tiny, super aggressive molecules. Once activated by the sun, they basically go on the attack, damaging cells, particularly the tiny blood vessels right under the surface of the skin and the very top layer of the skin itself, the epidermis.
Okay, so it's not the sun burning them directly.
Exactly. It's the sun activating a kind of poison within them, leading to that severe blistering and pain we see. It's an internal reaction triggered by external light.
So we've cracked the first part of the mystery. It's not just the sun, it's the sun plus these photodynamic agents inside the horse.
Right.
But that just leads to another question, doesn't it? Where do these mystery agents even come from? How do they get into the horse's skin to begin with?
That's the next logical step, yeah. These photodynamic agents can be either directly phototoxic, meaning toxic in light, or sometimes photoallergic, which requires a prior exposure to sensitize the horse.
Okay.
They reach the skin in one of two main ways. Most commonly via the bloodstream, or less often through direct skin contact. In horses, we generally recognize three types of photosensitization based on how these agents get there, though two are far, far more common and critical to understand.
Okay, let's unpack those. Let's start with the first, maybe the most straightforward type. Primary photosensitization, or type I. What's that about?
Right, type I. Primary photosensitization happens when a horse ingests or is injected with or maybe absorbs through the skin a photodynamic compound.
Okay.
And that compound goes directly into the bloodstream and settles in the skin. The crucial point here is that in these type I cases, the horse's liver is typically functioning completely normally.
So the liver's fine, it's just the compound itself.
Exactly. It's not a liver problem, it's the direct action of that specific compound once it gets to the skin and is exposed to sun.
So what are the common culprits for this type? Are we talking about specific plants, or could it be other things your horse might encounter?
Plants are definitely a big one. Many plants contain these types of agents. Think of St. John's wort, for example, which contains hypericin.
Right, I've heard of that one.
Or buckwheat, which contains phagopyrin. Spring parsley, bishop's weed, those are others. And certain clovers, like Alsike clover, can also be culprits.
Alsike clover.
Yeah, interesting. Yeah, Alsike clover is interesting because it can cause this primary type, but it can also cause liver damage, which, potentially links it to the other major type of photosensitization we need to talk about.
Ah, okay, so it's a bit of a double threat, potentially.
It can be, yes. Less commonly, certain medications can cause Type I weigh some tetracycline antibiotics, maybe some sulfa drugs like trimethoprim sulfa or phenothiazine tranquilizers.
Hmm, good to know.
And very rarely, maybe if a horse gets certain topical chemicals or coal tar derivatives on their skin, they could absorb enough to cause it, but that's quite unusual.
Okay, that makes sense. Now, you mentioned a second, more common type. You said it's often more serious. That's hepatogenous or secondary photosensitization type 3. And I have a feeling this is where the liver connection comes into full play.
It absolutely does. This is indeed the most common type we see, and often the most serious, precisely because it clearly indicates underlying liver dysfunction or damage. It's a big warning sign.
Okay, so how does the liver damage lead to the skin problem? What's the mechanism there?
Okay, here's how it works. When horses digest chlorophyll, the green pigment in plants, their gut microbes break it down into a compound called phylloerythrin.
Phylloerythrin, got it.
Normally, a healthy liver is incredibly efficient at filtering this phylloerythrin out of the bloodstream and excreting it, usually in the bile. It just gets rid of it.
Makes sense. Standard detox process.
Exactly. But what's truly fascinating and worrying is that if the liver is damaged or diseased, it can't do its job properly. It can't filter and excrete the phylloerythrin effectively.
So it builds up.
It builds up. Phylloerythrin accumulates in the bloodstream, circulates throughout the body, including to the skin, and then, just like those other primary agents, it acts as the photodynamic compound when the horse is exposed to UV light.
Wow. So the skin problem is almost like a smoke signal, isn't it? A
Yep.
critical red flag,
Yeah.
pointing us to a much deeper issue within the horse's liver. That's a huge difference from type I.
It's a massive difference, and that's why it's often more serious. You're not just dealing with the skin, you're dealing with potentially significant liver disease.
Okay, so what typically causes this kind of liver damage that then leads to secondary photosensitization? What should people be looking out for?
Many things, unfortunately. Toxic plants are a very frequent cause, as many contain hepatotoxic liver-damaging compounds.
Like which ones?
The pyrrolizidine alkaloid-containing plants are notorious. Things like ragwort, senecio species like fiddleneck hound's tongue, heliotrope. These often cause chronic, sometimes irreversible liver failure over time.
That sounds really bad.
It is. Other plants like lantana or clinegrass can also be culprits. Then there's moldy forage fungal toxins or mycotoxins in hay or pasture. Moldy Bermuda grass is one example.
Mold and hay.
Yeah, or certain fungal issues with the alsite clover again. Even blue-green algae blooms cyanobacteria in contaminated water sources can cause liver damage leading to this.
Water sources too. Okay.
And finally, other liver diseases themselves. Things like severe infections, liver abscesses, or a condition called serum hepatitis, sometimes known as Thaler's disease, can be the underlying trigger. It truly highlights how vulnerable the liver can be to various insults.
That is a lot to consider. It really makes you think about pasture management and hay quality, doesn't it?
Absolutely critical. Sometimes you feel like horses must just look at us thinking, can you please just give me safe food and water?
Right. Now, before we move on, you did briefly mention a third type, type 2, that you said is very rare in horses. Can you just touch on that quickly?
Yes, that's aberrant pigment metabolism, or type 2 photosensitization. This type is genuinely rare in horses. It involves a genetic defect leading to the excessive production of different photosensitizing pigments called porphyrins.
Ah, so it's genetic in that case.
Exactly. It's an inborn error of metabolism. So for our listeners, while it's good to know it exists theoretically, it's far less likely to be the cause you'd encounter compared to type I or especially type 3.
Okay, good to clarify. So considering these different pathways, who exactly is at risk for photosensitization? Is there a specific type of horse or location that makes them more susceptible?
Well, there's no overall genetic predisposition to photosensitization itself, apart from that rare type 2 we just mentioned. But horses with white or lightly pigmented skin or hair are definitely more susceptible.
It's less melanin.
Precisely. They have less melanin, which is nature's sunscreen, to protect those areas, so this applies to any breed with white markings, blazes, socks, patches.
Yeah.
Typically, adult horses seem to be affected more often than foals, and there's no specific difference between mares, stallions, or geldings. Geographically, well, you might see an increased incidence in areas closer to the equator simply because of higher, more intense UV exposure year-round. But the key risk factors, boiling it down, are that light pigmented skin and, critically, any pre-existing liver disease, which predisposes them to type 3.
Okay, so let's pivot to what it actually looks like. Once a horse is affected, how would someone, maybe just observing their horse in the pasture, recognize it beyond just thinking it's a really bad sunburn.
Right. The signs usually begin pretty soon after sun exposure, and the key is the location of the signs. The susceptible areas are almost always those with light-colored skin and maybe sparse hair coverage.
So like the places you mentioned,
Yeah.
muzzle, legs.
Exactly. The muzzle, lips, nostrils, eyelids, around the eyes, the ear tips, especially if they're white or pink, and any white blazes on the face, white socks or stockings on the legs, or white patches on the body. You might also see it on the ventral abdomen, the belly, or around the udder or sheath, and occasionally even the coronary bands just above the hoof, if that area is unpigmented. The pigmented or heavily haired areas nearby are generally protected, which is why those distinct white patches often stand out so dramatically.
And what's the progressions? Does it start subtly and then get worse?
Typically, yes. Initially, you might notice the horse seems restless, maybe agitated. They'll actively seek shade. They might start rubbing or scratching the affected areas excessively.
Itchy.
Oh, it can be incredibly itchy. Severely pruritic is the term. You'll see noticeable redness, erythema, and swelling, which is edema. With continued sun exposure, it progresses quite rapidly.
To what?
You'll start to see fluid weeping from the skin serum exudation, which then dries into crusts and scabs. Painful cracks or fissures can form. Hair loss, alopecia, is common in the affected zones. The skin can become thickened and hardened, leathery almost. And in severe cases, the affected skin tissue can actually die necrosis and then slough off, peel away in large pieces. It's really quite dramatic and painful.
That sounds awful. And you mentioned infections.
Yes, because that skin barrier is so badly damaged, secondary bacterial infections are a very, very common and serious complication. The bacteria just have an open door. It's as painful and serious as it sounds.
Definitely. And if it's the liver-related type 3, are there other signs to look out for beyond just these alarming skin issues, something that points more directly to the internal problems?
Yes, and this is absolutely crucial for diagnosing and managing the hepatogenous type. If significant liver damage is present, you'll often see additional, very serious systemic signs.
Such as?
Jaundice, or icterus, is a classic sign of liver trouble. You'll see a distinct yellowing discoloration, usually easiest to spot in the mucous membranes like the gums, inside the nostrils, or the sclera, the whites of their eyes.
Okay, yellowing. What else?
You might also notice the horse is lethargic, just seems depressed, maybe has weight loss over time, and a poor appetite, anorexia. Sometimes mild colic signs or other gastrointestinal issues can pop up.
And neurological signs. You mentioned those could happen.
Yes, in advanced liver failure, you can get neurological signs due to what's called hepatic encephalopathy. This happens when toxins the liver normally clears build up and affect the brain.
What does that look like?
It can range from subtle behavioral changes, maybe just seeming off or dull, to more severe signs like profound stupor, compulsive head pressing against walls or fences, aimless wandering, disorientation, and in the most severe cases, even seizures, coma, or a very unsteady, wobbly gait, which is ataxia. It's truly an emergency situation if you see those signs.
Wow. Okay, that really underscores the severity, especially with the liver type. So if a veterinarian is faced with these potential signs, the specific skin lesions, plus perhaps some of these systemic symptoms, how do they connect all these dots? How do they make a definitive diagnosis?
It's really a comprehensive approach, like putting pieces of a puzzle together. It involves combining the horse's history, the clinical signs we observe, and then specific diagnostic tests to confirm things.
So history first, what kind of information is useful there?
Absolutely. A detailed history is vital. We need to know about any recent feed changes, what kind of pasture access they've had, any new plants popping up, any new medication started recently, and how long has the horse been exposed to strong sun. The owner's reports of that specific pattern of dermatitis on white areas, plus any lethargy, poor appetite, mild colic, or if they've noticed that yellowing of the gums or eyes, that's all key information.
Okay. And the physical exam.
Then, a thorough physical examination. We carefully inspect all the affected skin, noting its exact distribution. Is it confined to those unpigmented areas? How severe is it? And critically, we look carefully for any of those systemic signs. The dermatitis itself, any jaundice, assessing the horse's overall body condition, looking for that dullness or somnolence, and checking for any neurological abnormalities.
And what about blood work? That sounds like it would be a really critical tool, especially for telling type I from type 3.
It's not just helpful, it's absolutely vital. Blood work is probably the primary tool for differentiating between primary and secondary photosensitization.
How so?
Elevated liver enzymes, things like GGT, SDH, AST, ALP, these strongly suggest liver damage and point us directly toward the hepatogenous, or secondary, type 3. Bilirubin, the substance that causes jaundice, may also be elevated if the liver isn't processing it correctly.
Oh.
A complete blood count, a CBC, and a full biochemistry panel also help assess the horse's overall health, identify signs of inflammation like high white cells or fibrinogen, check for anemia, and spot other metabolic abnormalities like low blood sugar, low protein, or changes in kidney values that can sometimes occur with liver disease. Bile acids are another really sensitive indicator of liver function that are often elevated.
You mentioned GGT specifically before. Is that particularly important?
GGT, or gamma-glutamyl transferase, is often considered a very useful indicator of certain types of liver damage in horses, especially damage affecting the bile ducts. And a special note here, if you're managing horses on a property where there have been known cases of pyrrolizidine alkaloid plant toxicity, those nasty plants like ragwort, even in other horses, routinely monitoring GGT levels in the whole herd, maybe every few months, can sometimes give an early warning of liver damage, even before clinical signs of photosensitization or liver failure show up. It can be a useful screening tool in high-risk situations.
That's a really practical tip. So, beyond checking the horse itself, what about looking at its immediate environment? Does that play a role in the diagnostic process?
A critical one, yes. We always recommend or perform a careful, thorough examination of the horse's pastures and any hay being fed. We're specifically looking for those known photosensitizing plants we talked about earlier, or the known hepatotoxic liver-damaging plants, or any obvious signs of mold in the hay. Often the clue, the source of the problem, is right there in the horse's surroundings. You have to look.
Right. Find the source. And what about biopsies? Can taking a sample of the skin or liver offer a more definitive answer?
Yes, biopsies can be very helpful. A skin biopsy from an affected area can confirm the characteristic microscopic changes of phototoxic dermatitis. Under the microscope, the pathologist looks for specific signs like damage and clotting in the superficial dermal blood vessels, inflammation around those vessels, and damage to the skin cells themselves, sometimes called apoptotic keratinocytes or sunburn cells. Chronic lesions might show different patterns.
And a liver biopsy.
If liver disease is suspected based on blood work and clinical signs, or if the cause isn't clear, a liver biopsy can be extremely valuable. It can help determine a definitive diagnosis for the type of liver disease and also give a much better idea of the prognosis. How severe is the damage? Is it likely reversible? Of course, because severe liver disease can affect blood clotting, we always check clotting factors with blood tests before attempting a liver biopsy, just to make sure it's safe.
Good point. Any other diagnostic tools?
Transabdominal ultrasonography can be useful too. Ultrasound allows us to actually visualize the liver, check its size, its texture or architecture, look for masses or abscesses, check the bile ducts for stones or thickening, and assess blood flow. And rarely, as we touched on, for that very uncommon type 2, we might need specialized tests to analyze porphyrins in urine or feces, or perhaps analyze feed and water samples if specific contaminants are strongly suspected. But usually, history, exam, blood work, and maybe environmental checks get you most of the way there.
Okay, so once the diagnosis is made, let's talk recovery. What's the path look like? What are the critical steps for treatment and management, especially given how painful and potentially serious this condition can be?
The absolute golden rule here is swift, early action. The sooner you intervene, the better the outcome is likely to be. And there are two absolutely critical first steps, hands down.
Okay, what are they?
Number 1, immediately identify and remove the causative agent. Whatever is delivering that photodynamic compound has to go. This means getting the horse out of the affected pasture immediately, physically removing any offending toxic plants from their environment, changing the hay source if that's suspected, discontinuing any suspect medications, obviously under veterinary guidance, or changing potentially contaminated feed or water sources. Stop the intake.
Stop the source. Makes sense. And step 2, you hinted at it before.
Step 2 is just as crucial, maybe even more so in the immediate term. Protect the horse from all UV light. Without this, nothing else you do to treat the skin will work effectively because you're not stopping the trigger.
So how do you do that effectively?
Complete confinement. Keep the horse in a deeply shaded stall or a completely shaded barn or run-in shed during all daylight hours. Turnout should only happen at night after the sun is fully down and before it rises.
Total darkness during the day.
As close as you can get. For milder cases, or if some brief, unavoidable sun exposure might happen during handling, then UV protective gear is essential. We're talking UV protective fly masks, especially those with extended nose and ear coverage, and lightweight, full-body UV protective fly sheets or suits.
Like full body armor against the sun.
Pretty much. And critically, applying sunscreens. You need child-safe, broad-spectrum sunscreens, especially those containing physical blockers like zinc oxide or titanium dioxide. Apply them liberally and frequently multiple times a day to all the affected white or pink skin areas. Think of it like painting on protection.
Okay, remove the cause, block the sun. Absolutely essential. Beyond that, what about treating the skin itself? It sounds like it needs a lot of soothing and protection while it heals.
It absolutely does. Supportive skincare is vital. First, gentle, thorough cleansing of the affected skin is important. Maybe using mild antiseptic solutions like dilute chlorhexidine or povidone iodine. This helps remove debris and prevent those secondary bacterial infections we talked about, because that damaged skin is just a perfect breeding ground for bacteria.
Gentle cleansing. Got it.
Then apply soothing topical treatments. There are many options: creams, ointments, sprays, things like silver sulfatazine cream, which has antimicrobial properties, nitrofurazone ointment, aloe vera gel, vitamin E creams. Zinc oxide paste itself can be soothing, or even medical-grade manuka honey, which has known healing and antimicrobial benefits. Botanical salves can also be helpful. The goal is to keep the skin moist, protected, and promote healing while reducing discomfort.
What about hydrotherapy, like hosing?
Cold hydrotherapy, so gently hosing the affected areas with cool water, can be very beneficial. It helps remove surface crusts and debris gently, it decreases inflammation and swelling, and it can help prevent strike flies being attracted to the wounds, which is a real concern.
Okay. Bandaging.
Bandaging might be considered, especially for affected lower legs that have a lot of swelling and fluid leakage. Exudate. You'd need to use clean, non-stick materials right against the skin, like Adaptic, then adequate padding, like sheet cotton, and applied firm but non-constricting elastic wrapping tape. Bandage changes need to be frequent and careful.
Right. And what about medications to help with the pain and inflammation or fight off infections?
Medications are often necessary. Systemic corticosteroids, like dexamethasone given by injection, can be very helpful in the early acute stages to rapidly reduce that intense inflammation, swelling, and discomfort. Topical corticosteroids might also be used directly on the skin lesions once the initial cause, the agent, has been removed and sun exposure is stopped.
Okay. And antibiotics.
Systemic antibiotics, given orally or by injection, are definitely indicated if secondary bacterial skin infections develop, which is common. Your veterinarian will choose an appropriate antibiotic based on the likely bacteria. Often broad-spectrum coverage is needed initially. Treatment might need to continue for 10 to 14 days, or potentially even longer if there's deeper infection like cellulitis.
And pain relief. It sounds incredibly painful.
Absolutely. Pain management is critical for the horse's welfare. Non-steroidal anti-inflammatory drugs, NSAIDs like flunixin, meglumine, or phenylbutazone, bute, are commonly used to manage pain and inflammation.
Any other supportive meds?
Sometimes D vitamins are given, either in IV fluids or by injection for general support. And in cases where there's evidence of significant damage to the blood vessels in the skin vasculitis, a drug called pentoxifyline might be used to help improve blood flow. And of course, seriously affected animals, especially if they're dehydrated or systemically unwell, will likely require intravenous fluid therapy for hydration and overall metabolic support.
Okay. Now, what if it's the hepatogenous type 3, and there's significant liver damage confirmed? What specific treatments are needed for the liver itself? Because that sounds like a whole other layer of critical care.
You're right, it is. If liver damage is present and diagnosed, it must be addressed immediately and specifically with supportive care aimed at helping the liver function and recover, if possible. This involves crucial dietary modification.
How so? What kind of diet?
The goal is to reduce the liver's workload, so we typically recommend low-protein, high-carbohydrate, easily digestible diets. High protein intake creates more ammonia, which a damaged liver struggles to process. So good quality grass hays or preferred oat hay is often recommended if available. Beet pulp is also a good, easily digestible fiber and energy source. High-protein feeds like alfalfa hay or concentrated grain mixes should usually be avoided or significantly reduced.
Makes sense. Less work for the liver.
Exactly. Liver support supplements might also be recommended, although the evidence varies. Things like SAMe, S-adenosylmethionine or milk thistle, silymarin, are sometimes used. Vitamin K might be needed if clotting is impaired, and intravenous fluids are often essential, not just for hydration, but also to help support liver perfusion and function.
And are there drugs to avoid if the liver is compromised?
Yes, this is critical. We must avoid drugs that could potentially worsen liver damage or that rely heavily on the liver for metabolism. This includes certain anesthetics like halothane, some sedatives or tranquilizers like phenothiazines or diazepam, high doses of some dewormers like ivermectin, certain antibiotics like erythromycin or rifampin, anabolic steroids, even aspirin. The vet needs to be very careful about any medications given to a horse with liver disease.
That's a really important consideration. It sounds like a complex and intensive recovery process overall, requiring a lot of care and vigilance. Are there any other general nursing care considerations?
Definitely. Good nursing care is paramount, and dedicated owners can often provide much of this under veterinary direction. Stall rest is usually needed initially, followed by gentle hand walking as tolerated once the horse is feeling better, no forced exercise. And of course, that continued, strict protection from sunlight is non-negotiable throughout the healing process. Providing excellent, highly digestible nutrition tailored to their needs, especially if the liver is involved, is essential for healing.
And surgery, if that ever needed.
In cases where there's significant tissue death, necrosis, surgical debridement, which means carefully removing the dead, sluiced skin might be necessary to allow healthy tissue underneath to heal properly and reduce the risk of ongoing infection.
Okay, so looking ahead now, how can we prevent this potentially devastating condition from happening in the first place? Prevention is always better than cure, right?
Absolutely, prevention is key. And it often comes down to management. Regular, meticulous inspection of pastures for those known photosensitizing or liver-damaging plants is essential. If you find them, they need to be removed either manually pulled or through appropriate pasture management techniques like targeted spraying, though you need to be careful with herbicides too.
Good point. What about hay?
Ensuring hay is good quality and free of toxic weeds and visible mold is also really important. Store hay properly to prevent mold growth. Be aware when introducing any new feeds or supplements, check the ingredients, be mindful of potential effects.
And medication.
Always discuss potential side effects, including the possibility of photosensitivity with your veterinarian whenever starting a horse on a new medication, even common ones. Just ask the question.
Proactive communication.
Exactly. And for horses that just naturally have extensive white markings, especially in sunny climates or during peak summer months, consider routine sun protection as a preventative measure. This could mean using those UV protective fly masks and sheets regularly, or simply keeping them stalled during the peak sun hours of the day, maybe from 10 a.m. to 4 p.m.
That makes a lot of sense for susceptible horses. What about monitoring, either for prevention or after an episode?
Well, as we mentioned, for horses on properties with known risks, like pastures containing pyrrolizidine alkaloid plants, periodically monitoring GGT levels in the whole herd can be a valuable proactive screening step. For the horse recovering from photosensitization, especially the liver-related type, continued monitoring of hepatic enzymes and blood work, like the CBC and chemistry panel, is important to track the liver's recovery over weeks or months.
And finally, what's the prognosis? If a horse goes through this, can they make a full recovery?
The prognosis really varies. For primary photosensitization, type 1, if it's recognized early, the offending agent is removed completely, and good supportive care including sun protection is provided, the prognosis for full recovery is generally fair to good. The skin usually heals, though sometimes scarring or changes in hair color can remain.
And for the liver type?
For hepatogenous photosensitization, type 3, the prognosis depends heavily on the severity and, critically, the reversibility of the underlying liver damage. If the liver damage is mild and caught early, and the cause removed, the liver might recover and the horse can do well. However, severe chronic liver disease, especially the kind caused by those pyrrolizidine alkaloid plants, which causes extensive scarring or fibrosis, often carries a guarded to poor prognosis for long-term survival, even if the skin lesions heal. The liver damage itself might be too extensive. Possible complications like those secondary bacterial infections or, in severe liver cases, the development of hepatoencephalopathy obviously worsen the prognosis significantly.
So early detection and addressing the root cause, especially if it's the liver, is absolutely critical for the outcome.
Absolutely. Time is of the essence.
Well, this deep dive has certainly shown us that equine photosensitization is far, far more than just a bad sunburn. It's such a complex interplay of sunlight, specific chemical compounds, and so often the crucial health of an incredibly important internal organ, the liver.
It truly highlights how interconnected a horse's health systems really are, doesn't it? And how sometimes those visible surface signs can be vital messengers telling us about much deeper issues going on inside.
So what does this all mean for you listening today? When you see a horse with suspicious skin lesions, particularly on those white or pink areas, remember what we've discussed, that visible damage on the surface might just be a critical signal, a warning flag about something much deeper. What new understanding, what new perspective does this bring to how you'll observe your own horses or advocate for equine health moving forward?